Hi, in this video, I'd like to help us get to know the body more by getting to know the abs more. Now, when we think of the abs, we often think of the six-pack, the chocolate tab abs, and this is true, they're part of the abs, but this is only one of 4 layers. So it's the most superficial layer, scientifically known as the rectus abdominis, and let's look at the 3 other layers underneath it. I'd like to start by showing us the origins of these different muscles, and then we'll look at the movements they do and how we can become more aware of them and strengthen them. If you go to the middle of your chest, you'll feel your sternum. If you go down the sternum, you'll reach the end of it, which is called the XIPHOID process. Now, for most people, this is a downward triangle. Now, this is part of the top insertion of the rectus abdominis. If you feel next to it, and going up and down with your fingers, you might feel what's like ribs, but is the costal cartilage. So it's a prolongation from the ribs all the way to the sternum. And around your ribs 5 to 7, this is also going to be where the rectus abdominis inserts. And then it goes all the way down to your pubic bone, which is actually the pubic symphysis and the pubic crest. This is your most superficial abdominal muscle. Going down a few layers, we're going to have the external and the internal obliques. Now they insert anywhere from the 5th to the 12th rib, and they go all the way around the body, almost to the vertebrae. They insert on the iliac crest. If you feel the side of your hips, you should feel a wave-shaped bone. This is your iliac crest, going from just next to your sacrum at the back of your body, all the way forwards, and both the external and the internal oblique are going to insert on this iliac crest. Now, before explaining the deepest abdominal muscle, I'd like to explain the purpose of these 3 different muscles we've seen before explaining the deepest abdominal muscle. So a muscle is only ever going to bring 2 points of insertion closer together. So in the case of the rectus abdominis, if the hips are not moving, it is going to pull the body forward. Actually, all abs will contribute to flexing the trunk forward. If the trunk is stable, then it will lift up the pubic symphysis, which will contribute to a pelvic tilt, which I'll talk about in another video. The rectus abdominis, as well as the external and internal obliques, will contribute to increasing pressure in the abdomen. Now, if we're carrying heavy objects, the pressure of that object is going to be pulling our spine forward. When we increase the pressure in our abdomen, we're actually creating a sort of high pressure balloon in our abdomen, which then presses backward against the vertebrae. And so it can counteract the pressure of whatever we're lifting and helps to stabilize the spine. Increasing the pressure in the abdomen also helps with breathing out, with coughing, and can help with childbirth. The external and the internal obliques both contribute to lateral inclination. So it's pretty straightforward. They both contract to pull the trunk sideways. However, this can get tricky, as I know it was for a lot of physios in exam. When you are rotating the trunk, the external and the internal oblique work differently. The internal oblique will help you rotate in the same direction, and the external oblique will help you rotate in the opposite direction. So if I'm rotating to the right, it's my right internal oblique and my left external oblique, which help me turn. In terms of my left rotation, why don't you try and figure out which muscles will be active? Okay, so we've covered the actions of these different muscles. Now let's look at the 4th deepest layer, the transversus abdominis. Now this muscle shares a few insertions with the external and internal oblique. It's going to attach almost all around the body on the lower ribs and on the inside of the iliac crest. So let's imagine my arm is the iliac crest. You first have the external oblique, then the internal oblique, and then you have the transversus abdominis. So together these create that abdominal wall, and it's probably from there that we got this idea of having a core. But because it's quite a deep muscle, it's often quite hard to become aware of it and to know how to tighten it. So let's look at an exercise to become more aware of the transversus abdominis, and then I'll show different stages of exercises to strengthen it. I'm doing this exercise lying down because it will be easier for me to feel the muscle contracting, but you can try this sitting or standing and you might succeed as well. So the first part of the exercise is going to be feeling the iliac crest. So we've been feeling it before. We're going to follow it until we feel a protruding lump. This is the anterior superior iliac spine. And then we want to take our fingers and we want to put them on the inside of that bone. If you remember, it's because we have first the external, then internal obliques, and then we have the transversus abdominis. So we have to put our finger towards the inside of that bone to feel the insertion of the transversus. Next, what we're going to want to do is imagine we're putting on jeans that are too tight and we're pulling in our stomach to get them on. Something else you can think of is you're trying to pull your belly button inward. If you're doing this correctly, you'll feel the transversus push against your finger as you're holding onto its insertion. If this doesn't work, I can try coughing and maybe I'll feel its insertion. Once we've felt the insertion of the muscle, we want to then try and consciously tighten it for 15 to 30 seconds while breathing. The next level of difficulty is going to be going on all fours. Gravity will pull the organs down and it'll be harder for the transversus to pull them upward. So once again, I'm going to feel for the anterior superior iliac spine, put my fingers toward the inside of it, and then try and feel the insertion as I pull my belly button in. Once I have it, I'm going to hold this and breathe for 15 to 30 seconds. Now I'm going to try and hold the contraction of the transversus abdominis while doing another exercise. In this case, let's do the one where you lift up one arm and you lift up the opposite leg and then you switch. We're going to do this for 30 seconds and we're going to try and keep that muscle contracted. We've covered the transversus abdominis. Now let's look at what we can do for the obliques. I'd say a good starting exercise will be to do a side plank from the knee position, holding this from 15 to 30 seconds. I recommend doing this on each side. Once that's easy enough to do, I would do this with legs straight, trying to keep more or less a straight line in between my heels, hips, and shoulders. I would hold this for 15 to 30 seconds on each side. If that becomes easy, I would do lifting up the hips while in a plank position for 30 seconds. This will make the exercise go from static to dynamic. Finally, another exercise for the obliques is bicycle crunches. I'm making sure that I'm detaching my shoulder blade from the ground for the rotation. And I'm controlling my legs as I switch in between these. This is how I would recommend doing bicycle crunches. And finally, to work the rectus abdominis, I recommend doing crunches. And the form is going to be quite similar to the bicycle crunches, as in we want to go until we lift the shoulder blades over the ground. Once we've done that, we don't have to go much higher. Anything from here to here is actually going to be the iliopsoas mainly pulling our body up. So to really just work the rectus abdominis, I recommend just lifting up the shoulder blades and going back down. Another tip I have is if you've seen my videos on taking care of the neck, you'll know about the chin tuck. And so when I do abs, I tend to do a bit of a chin tuck. I find that it works my neck less when I do lots of reps. So I recommend doing this for at least 30 seconds. Well, that concludes our video on abs. For more exciting videos, or if you want to get to know your body more, follow postureplan.com for more.